Hello, my name is Caesar Adam, and today I'm in Adult Health 1, and today I will be demonstrating a nasogastric tube irrigation and insertion. The first thing I would do, I would check the doctor's orders and see what type of tube has been ordered. I would approach my patient, get two identifiers, name, date of birth. I would do hand hygiene before I even dealt with the patient. First, I would assess the patient's nasal cavity, check for a deviated septum or any previous surgeries, look at moral cavities as well. I would ask the patient to occlude one nair to see which nair is most patent. Just for the sake of the video, we're going to say the nostril on this side is more patent nostril. The next thing I'm going to do is I'm going to apply gloves. The next thing I'm going to do, I'm going to estimate the length of the tube from the patient's nostril to his stomach. I'm going to measure from his nares to his tragus to his xiphoid process. So, starting here, I'll measure here, and then around the ear, and down to about the xiphoid process. It's about right here. It's good. It's about 65. The measurement on the tube. I will apply tape to the tube to make sure I already prepared my tape, to make sure that I do not lose track of my spot. After I have this established, I'm going to lubricate about approximately 4 inches of the distal end of the tube with a water-based soluble lubricant. And I will tell my client that insertion is about to begin. I do have an assistant. I'd like to ask for my assistant to tilt the client's head back for me at the moment. Normally I will ask the client to tilt their head back for me, but since this is a dummy, I require assistant. And I want to begin to slowly insert the tube into the client. Slowly and easily. Make sure there's no resistance. I'm going to check the back of the client's pharynx. Make sure I don't see any coiling. Alright. Now I'm going to ask, normally I will ask the client to tilt his head forward and then ask the client to swallow as I continue to slowly insert the tube. I'm going to go very slow. If there were resistance in the tube, I would stop, go back a little, assess the client's mouth for coiling. No coiling, I will continue to insert until I reach. For the moment. Alright, I've approximately reached where I need to go for my client's, for his nostril. Now I'm going to tape it to the client's nose for the time being. Give the satisfaction. Okay. I will ask the client to speak. I would assess the nasal pharynx for coil 2. And also, I'm going to aspirate for gastric content at the end of the tube just to make sure that I can get gastric content. I'll go slowly. for the sake of the video, the gastric contents appeared to be appeared normal color. So I'm slowly going to and when I reinsert, I'm going to check for bowel sounds using my stethoscope. I get my stethoscope and grab it.
Good.
The patient's gown so I can listen for bowel sounds. Let's listen to the gown for the moment. I'm going to re-inject the acid gas. Listen for a swishing sound. Alright. I do hear a swishing sound. I'm going to remove this from the moment, and I'm going to kink it with a rubber band using a slip knot. Just kink it so the way it doesn't bend back. I'm going to pin this to the patient's gown, the rubber band. And I'm going to tape back to the patient's nose. That's not going to work.
Awesome. That one, no mistakes whatsoever.
Now the patient's face. Okay. And alright, I've already, and if this were in the hospital, I will attach the video of the suction. But since the low intermittent suction, but since I'm not attached to low intermittent suction, I'm just going to pin to the patient's gown. And that ends the insertion portion of our video. Now for the irrigation portion of our video, I will implement standard protocol again. After the patient's name, date of birth, I'll wash my hands before I get started. I will disconnect the patient from the suction, and then I will check the placement of the NG tube. I'll check his mouth. And I will also, before I do that, I would aspirate for contents again. I would re-check for gastric content before I reinserted it. Color is normal. I'll listen for a swishing sound.